Welcome. This is the Real Life Cafe, a safe space where we get to discuss matters real life. And today it's matters parenting. We are going to discuss a topic that is very interesting, something that is giving moms sleepless nights. I am joined by Dr. Ruth Kihara, who will help us narrow down on colic. My name is Juliet. Welcome. Hi, Daktari.
Hello, Juliet.
How are you?
Very well.
Good to see you.
Good to see you too.
Nice. Kindly introduce yourself and tell us your profession and what you do.
All right. I'm Ruth Kihara, Dr. Ruth Kihara. I'm a pediatrician. As much as I'm a pediatrician, I'm also a teacher. I teach at Mount Kenya University, Department of Pediatrics. And yes, I work at Emory as a pediatrician. I have clinics here on Wednesday afternoons.
Wow, interesting. So today we are talking about colic,
Yes.
something that is giving moms sleepless nights. So we can begin by understanding what colic is.
All right. So colic is one, we have to have a perfectly healthy baby who cries and cries inconsolably. In its definition, there is what we describe as the rule of threes. So what that means, it means you have a baby who's crying for more than 3 hours per day, more than 3 days in a week, and for more than 3 weeks. So you have a baby who's perfectly healthy. That's the most important thing. Who cries for more than 3 hours in a day, cries 3 days, more than 3 days in a week, and for more than 3 weeks.
Okay. So other than crying, is there any other symptoms that that come along with with the crying, so that we can tell now this is colic?
Yeah. Maybe also in describing it, I should describe the age at which it starts. It mainly starts at 2 weeks, peaks around 6 weeks, and eventually it abates at around 3-4 months. But you have a few who will go on until 6 months. But majority will start at 2 weeks, peak around 6 weeks, and around 3 to 4 weeks. Few children will finish by 6 months. Yes. So the other symptoms that the babies will present with include flashing of the face, become red.
Red.
Yes.
Okay.
Yeah.
The face.
The face becomes flushed pink. Yeah. They also arch their back. Yeah. So the back appears arched. All right. Then they will also...
That is when positioning themselves.
Yes.
Okay.
Yes. Then they will feast as well. Appear as if they are feasting. Yeah. Then when you hold the tummy, it feels as if it's tight.
Tight tummy.
Yes. Tight tummy. And then now they cry.
Okay.
Yeah.
Okay.
Yeah.
Wow. And
the other thing I forgot is they also need to flex their legs upwards towards the tummy. Yeah. So they'll lift up their legs upwards towards the tummy, and the tummy feels a little hard. Yes.
So why the flicks? Is there pain or?
Yes. It's colic is really part of transitional physiology. Yeah. So we really don't know the cause, and we really can't describe exactly what the baby is feeling. Yeah. But it's been thought, theories. It's been thought that because the gastrointestinal system is going through a transition from being in the uterus to now being outside, breastfeeding, digesting, production of enzymes and all that. Yeah. Many moms will actually think it's because the baby is having tummy pain.
Okay.
But not really. Yeah. At times also overstimulation is associated with it. If the baby is somewhere where there's so much noise, so much light, so much movement, yeah, so they can get colic. It's also good to know that the ratio is the same between girls and boys. So we don't have it more in boys, as many people would explain. It's basically the same. So those are the main symptoms, but it's not really because they have pain in the tummy. Other people also think that colicky children are gassy children. They have lots of gas, but that's not really the case. It's only that as they are crying, they swallow in a lot of gas, so they tend to pass more gas, but it's not because they have gas and that's why they are crying. They're crying, they swallow in gas. So they tend to be more gassy as a result of the crying. Yes.
Okay. So someone would ask, you've said like there is no, cause.
Yes,
There's no
known cause. Yes.
But what really happens? What do moms do wrong, maybe during breastfeeding or during any other activity with the baby that can lead to the colic?
To the cause,
Yeah.
to colic. Huh?
Yeah.
Okay, as I said, it's theories. And some of the theories also postulated is as the baby, if probably mommy is not very comfortable in latching the baby on the breast. And as the baby is breastfeeding, is also swallowing lots of air. Yeah. So that air, that gas tends to cause, disturbance, intestinal disturbance. And so the baby becomes fussy. Yeah. Another thing is if mommy does not burp the baby properly after breastfeeding. And so the gas that was, that the baby was swallowing as they were breastfeeding, if it doesn't come out, it makes the baby uncomfortable.
Yeah.
But all those are just postulates because you can have a baby who would probably have issues with breastfeeding but does not cry, does not have colic. Yeah. So, and you really can't predict this baby will have colic, this baby will not have colic. So it just happens. Yeah.
Okay. And the best way to burp a baby, because I remember with my second born, I was having a very hard time trying to burp her.
Yeah.
Every time we feed, she couldn't burp. We feed again, she's not burping. But I never experienced that, the crying and all that. So how best can we burp them? Yeah.
So basically what you need to do when you're burping is to apply pressure on the tummy. So there are several ways to do it. You can place the baby on your shoulder. So basically the baby's tummy is pressing on your shoulder.
Yeah.
And then you rub in between the shoulder blades. Yeah. So it's interesting, as you say, some children just never bring up anything.
Yeah.
And we've been taught that when they bring up milk, that's when the burp has been
happened.
successful.
Yeah.
Some just never bring up anything. At times it's air with no milk. So you'll be there waiting for milk to come out and nothing happens. Yeah. So that's one way to do it. The other way is to turn them on your lap. The tummy presses on your lap, and then you rub again the shoulder blades, in between the shoulder blades. Ideally, the pressure you are applying on the tummy should be able to help in bringing out the gas. Yes.
Okay. And you've said like one can take a lot of time trying to help the baby burp and they are not burping. You can imagine this mom, maybe it's her first week, second week, and maybe they are still in pain. What would you advise like the parents there, in terms of the support system around the house?
Yeah. Yes, so it's quite important that when a mom has just gotten a baby, that there is good support system for her. This support system can come from the people living with her or the immediate family around her. Yeah. So we can have our partners, if they are there. We can have our moms, they are very good in this, and mom-in-laws, our sisters. So once the mommy has breastfed the baby, it would be nice for the support system around her to help with the burping, because this can be done by anyone, as long as they are instructed on how to. Yeah. So it is encouraged that the baby, that the support system assists the mom with burping. It's not very easy actually. Yeah, for some babies.
Okay. And someone might ask, is there a way, you know, that you can help prevent the colic thing? Yeah.
Prevention, not really. As we said, we don't know really the cause, but there are ways to ease the colic. Yeah. Maybe if on the, I can touch on the how to latch the baby on the breast. Yeah. You need to make sure that the baby's mouth is wide open. Then the nipple plus the areola goes into the mouth of the baby. The lower lip is, you know, upturned downwards. Yeah. And as they are suckling, you can actually hear the baby suckle and swallow.
There's usually a sound sometimes you hear,
Yes.
like, I don't know, I can't even remember. Yes.
That sound.
So that's when you hear that, you know you're
not doing the right thing.
Okay.
When you hear that, you know you're not doing, okay, we are not breastfeeding properly. We are taking in lots of air, and there are causes. They are actually the anatomical causes as to why that would happen. Okay, well, it could be because the latching has not been done properly, but also if the baby has a tongue tie.
A tongue what?
Tie.
Okay.
Yeah, or a lip tie. That can also cause the baby to take in lots of air when they are suckling. And at times, not even to attach properly on the breast.
Okay.
I've had mummies who come to me, they are desperate, frustrated. What can I do? My baby is not attaching on the breast. My breasts are engorged. And when you do physical examination of the baby, you actually find there's a tie. So it's just just some soft tissue attaching the tongue to the, you know, lower palate, the soft palate. Yes. So if that is present, we encourage just a, you know, surgical intervention.
Really?
Yes.
Wow, I'm learning that today.
Yes. Because eventually it can also affect how the speech, how the child will eventually pronounce some words. Yeah. Yeah.
Okay.
Yeah.
Okay. Is there any other way like that can help moms manage the colic?
Yes. Now we have several soothing techniques that we can use to make the baby comfortable. One is actually just giving the baby a bath.
Oh, wow.
Just undress, give the baby a nice long bath. Two, you can also, and as you give the baby a bath, when you're done, you're applying oil, you can actually do a nice massage on, a whole body massage. You can also take the baby out for a walk, or a car ride. Yeah, that the car motion actually suits the baby. Yeah, you can also music.
Wow.
Our babies love music, by the way. So if you can have nice soft music, it actually helps in calming the baby. Reducing stimulation such that there's no much light, no movement, you keep the baby in a not so lit, room.
Yeah.
Also helps in calming the baby. There's also what we call the white noise. So like a vacuum cleaner, the noise it produces. So you have like a one wavelength kind of sound. It also helps in soothing the baby. Yeah. So they are just soothing techniques, but not really one single medicine. Mammies look for a magic bullet to this because of the desperation and the frustration they're going through. So they'll ask you, can I use, I don't want to mention names of the medicines, but yeah, all those don't help really.
Okay.
Yeah.
Interesting. And is there a point that you get and say now you're at home, you have tried all those soothing techniques, but nothing is changing, the baby is still crying, the baby is still fussy, and now it reaches a point you have to seek medical attention. Have you received such cases?
Yeah. Yeah. There are such children where you feel, now the crying is too much. There's something more.
Yeah.
So when they come, there are several causes that can actually, things that can make a baby cry more than usual. Yeah. And one case in point is, say, a baby who has allergy.
Okay.
Milk intolerance, yeah, lactose intolerance, or they are allergic to cow milk, and mommy is consuming cow milk because she wants to make lots of milk, and so she's taking lots of chocolate, lots of milk, lots of uji with milk. Yes, this cow milk that mommy is consuming could actually affect the baby's gut.
Okay.
Yeah. So if they have allergy, we will definitely get abdominal pains. Yeah. So that stops being colic. That now is a medical issue that needs to be looked into. Though the baby will present with other features of allergy, either eczema, or a blocked nose constantly, or runny nose. Yeah, such things. Yeah.
Okay.
So if you see a child who's super fussy and they have other features of allergy, probably you should think that probably have cow milk allergy. Yeah. Other causes include reflux. Yeah. There are children who bring up more than ideally they should. And how do you tell that they're bringing up more? The weight. They don't gain weight as they should. Yeah. Because bringing up milk is normal. But now when the baby is bringing up more than they should, then it's a concern. And how do you know they're bringing up more than they should? By the weight check.
Okay.
Yeah. So you notice this child is not gaining weight. He's bringing up lots of milk. He's super fussy. Then you need to think reflux. Yeah. Then infections can also make a baby cry more than they should. Things like meningitis. Present with a baby who's super irritable and they are unconsolable.
Okay.
Yeah.
Okay.
If there's fever, now those are other things that when you see, you say, no, this is not colic. Definitely this baby has got other issues that probably need attention.
Okay. Interesting. Actually, I'm happy I'm learning so many things today.
That's nice.
And I would want you to give, your last comments, maybe an advice to moms, like an encouragement, because for sure colic I've seen so many moms, like say, this thing has given me sleepless nights, and it's not one mom, it is not two moms, there are many. Actually, even in so many groups, when you just mention colic, you just see comments like, where?
I know.
Where? Wachia hapo.
Yeah.
Because you have just given birth, you expect to go home and have that good time, enjoying the bonding with your baby. But now here, there is this crying and fussiness. Maybe you can encourage moms out there, tell them to always seek help, or help when they feel that things are not okay.
Yeah.
Yeah.
Yeah, that's true. It can be a very difficult time for mom. And at times it's a CS delivery.
Yeah.
And you have a mom who's going through her own healing, and she has a fussy baby with her.